This conference will now be recorded.
Okay, so let me turn up my volume here a little bit. Um, Again, good morning. This is Jeffrey Popkin. I am a independent consultant working with the Bakersfield ARC. They have a grant contract with the Kern Regional Center and the Department of Developmental Services to do training and to assist with service providers becoming compliant with the home and community-based waiver, the federal government standard that they want all providers who receive Medicaid funding. In California, it's called Medi-Cal, but receive funding specifically for providing services. And California receives 50 cents on a dollar of all services that they provide that are Medi-Cal eligible, Medicaid eligible. And I just put out a new newsletter yesterday afternoon, and if any of you have had a chance to look at it, you'd see that about a third of all of the dollars that California spends on developmental services has to do with the home and community-based waiver. And so, so the feds are putting in about 3 billion. California's putting in about that much, and that's out of a 14 plus billion-dollar budget for developmental services. So this is a big part of the services that the regional center coordinates and that you provide are under the waiver. So it's important that we do this. The federal government, as most of you know, put out 10 rules that they want everyone to adhere to as part of waiver funding. And that went into effect as of March 17th, 2023. California submitted a plan which shows that um, all of the providers when you looked at their program design and the answers that they gave to a series of questions were all in compliance. Federal government came back and said, okay, people are in paper compliance, but we want to actually have um, someone go out and assess to see if what's on paper is what's actually happening in these homes and facilities. So many of you have had or will be having your evaluation coming up shortly. Kern Regional Center has to go ahead and have all of the facilities, approximately 175, completed by August 31st of 2024. So, and they're about, I believe, down to about 125 that they still need to look at and do an assessment on. Kern Regional Center is looking at a contract. I'm involved with that additional contract. It's not through Bakersfield ARC, but if that goes through, there'll be a group of independent consultants who will be doing the assessments rather than Kern Regional Center doing the assessment. So stay tuned on that. Either way, you're going to be assessed if you're Medicaid, if you provide Medicaid waiver services, and they're going to be looking at the 10 components of the waiver to final rules to make sure you're in compliance. Okay, moving on. Maybe. Okay, if you want continuing education for today, uh, there are certain requirements that you need to meet. You must attend the entire community of practice in order to get CEU credit. If there's more than one person at your program that is watching this, and you want continuing education for each of those individuals, you need to either put it on the screen here, both names, or send a chat message to Valerie, who is on today, letting her know that there are multiple people taking it, because we can't give credit if we don't have documentation that you're on the presentation. Um, we ask that you request the credit within 30 days. It makes it so much easier for us to do the housekeeping if we do these promptly. Um, you, again, must identify yourself. And finally, at the end of this, we want you to send an email to uh, Irene at Bakersfield ARC. And in that email, we want you to put down 3 bullet points of what you learned today. Just briefly, something that you got out of today's webinar. And the reason we do that is because A, it reinforces that, because if you write it down, it's going to stick a little bit better. And B, that way we know that you were on the entire call, or the webinar. So please make sure you follow these rules if you want credit. So if you come back 6 months later and ask for credit and you haven't submitted anything, it won't happen. We are working very closely with Kern Regional Center to make sure that the integrity of these units uh, are maintained. So we do respectfully ask, you're on your honor here if you want the continuing education credits for both regional center and for community care licensing. These are the steps that you need to follow. Okay, I may sound like a broken record for those of you who have been on previous uh, webinars or communities of practices that we've done, but this is really something that's I think is very special. It's just phenomenal that we were able to get uh, an organization called CQL, the Council on Quality and Leadership. Uh, they are a national organization that does training and accreditation of programs for both, for the developmentally disabled, for mental health, and for elderly. And we have contracted with them to buy a series of classes. Just real briefly, we're asking people to turn off their cameras. Last week we had some disruption based on that, so we prefer that you didn't have your camera on today. So for those of a couple of you that do have it on, if you don't mind. Um, um, so, anyways, hang on a minute here. Let me. I think a cat's going by, so my dog is having some challenges. The quality for leadership will be offering a series of webinars. Now, some of these have occurred already, and we're repeating them to make sure we get the maximum number of people involved with them. Excellent presentations. Not only are they good presentations, but they have a whole series of both videos throughout the presentation and give you materials at the end. They give you a slide that's got resources that you can use. So if you're a facility and you're training your staff, you want to share this with the persons that you serve, their families, other folks. Excellent place to get resources, excellent place to learn about the resources that are out there. So if you haven't taken any of these courses, I really strongly encourage you to get on board. They're on usually on Thursdays from 9 to 1, and we've got exploring communications coming up in July. We've also got um, the 3 E's, the foundation of informed choice. Informed choice is where individuals who are served are making choices about their lives with the information necessary to make that choice. I've mentioned before to some of you who've been on these webinars that I was involved years ago in the initiative to move people out of the developmental centers. They used to be called state hospitals here in California. And when we went up to, let's say, for example, Porterville, and met with a person who resided up there and said, hey, so we're going to move you out into the community, where would you like to live? Would you like to live in a group home, a small family care home, independent living services, supported living services? We have a whole array of different types of residential options that you can be involved with. Well, here you have somebody who's lived at Porterville for the last 25 years. And to share with them, here are your options, but they've never had any exposure to those options, is not really that helpful. So what we found after a little
Mhm.
while was we'd bring people out on field trips and have them stay at the different types of facilities for a night or two. And then when we came back and said, okay, so which one of these types of facilities did you like the best? We got a much more informed decision because the people had some understanding. We've seen similar type of things when we have uh, started doing community-based day services where we tried to do the activities for that day around what the individuals in the activities would like. And when we first started asking people, where would you like to go? What would you like to do? Um, many of them said, well, I'm getting an echo here. Yeah, are you hearing that echo too?
You have Janie Patino. She's not muted.
Okay. Whoops. All right. Thank you. That did it.
Sorry, I'm
Uh, so that's no problem. Anyways, the when we first started asking individuals, where would you like to go and what would you like to do? One of the themes that we heard over and over again was Valley Plaza, Walmart, Dollar Tree, and for many of the individuals who we were serving, that's the sort of community that they knew. So they didn't know necessarily about activities that could be done at the Veterans Hall, at the Senior Center, at going out bowling, being involved with the Social Recreation League, because that wasn't part of their repertoire. So informed choice is all about giving people the information so that they can make the choices that are important to and for them. Then we have coming up the community and building community, and how do we go about getting people more involved in what's going on around them in the community. On Sunday of this last week, we decided to go out for a brunch type breakfast, and we ran into the marathon and had to go through all kinds of detours to get where we're going. Well, that was an event that was occurring last Sunday. People could go out and cheer on folks and have a good time. And that's just one of many events that is occurring all the time here in our local community. And how much are the people that we serve participating in those community activities? Um, Then the next one coming up would be enhancing the dignity of risk. Again, we take risks every day. It's a part of life. I mean, if you drove to your office this morning, that was fairly risky behavior in terms of getting into your car and driving because car accidents. About 47,000 people are killed every year on the highway. But we weigh that risk against what we're trying to accomplish, get to work, to be productive, being able to then take care of ourselves and our families. So for the people we serve too, teaching someone how to use the Get Bus. There's a certain inherent risks in terms of independently using the bus system, and is that something that we want to assist? If the individual says this is something I want to do, I want to be more community independent, and that's how we get them there. Then what do we do to really help them understand how to be as safe as possible um, in doing that? And then finally, we've got two sessions on person-centered planning coming up. Now, person-centered planning is a pretty extensive um, training. The Kern Regional Center, Shannon Luke, and also John Noriega from Kern Adult Program offer. They are both certified trainers in person-centered planning, and they offer a week-long course in that. This is just an introduction. It's 4 hours, but it gives you a pretty good understanding of an overview of what person-centered planning is all about. It's a different way of doing the IPP, where years ago we would sit in meetings and we would talk about the client or the individual served with them sitting right there. He or she is sitting at the table, and we're talking about them like in third person and not really asking them what they would like. We're talking about them rather than to them or with them. And we want to get away from that approach to service provision. And the meeting is the individual's meeting. It's not our meeting. We're there to help facilitate and to make sure that the array of services that are available to that individual are known and the options presented. And we look at there's because we work in a bureaucratic system, we have to sort of go through certain things and what have you. But it's the individual's meeting, and this is a good first step in learning about that. Okay, moving on. In June of this year, oops, so I get the slide to go up. Some of you may have attended the training last year that Dr. Tom Pomerantz from Indianapolis, Indiana, came out and did. He's a national and international speaker who has a very unique perspective on how services should be provided to individuals with intellectual and developmental disabilities. And he's very entertaining, has lots of slides, has lots of resources. It's a good day, and lunch is served too, so you get free lunch out of the deal. Anyways, he will be here in Bakersfield presenting at the Kern Regional Center in their Malibu room, which is their big conference room, on June 10th through the 13th, with one exception, and that is on June 12th. That day is exclusively for the individuals that we serve and their families. The other 3 days, the 10th, the 11th, and 13th, are for service providers, DSPs, administrators, owners, people who are involved in this field who want a professional perspective. His primary topic this year will be moving persons towards employment. California is a state that says employment first, so we really want to look at employment prior to day activities for adults, other types of services, and California, as part of its corrective plan, part of the plan that it submitted to the federal government to fully implement HCBS, the feds had some concerns that California needed to do more in the area of promoting employment for persons with intellectual and developmental disabilities. So that's what his topic is going to be on the 10th, the 11th, and the 13th. And that will go from basically 9 to 4, half an hour lunch in there. And if you go to the newsletter that came out yesterday, the one from Bakersfield ARC, there is a pretty good sized blurb in there about this training, and also there is a link to the registration. It says Dr. Pomerantz registration. It's in blue on the newsletter. It's a link, and if you just click on that, it takes you, asks you a few questions about what type of provider you are, what your background, and then also if you have any special needs for the presentation, special dietary restrictions, needs for accommodations, etc. At this point, we are looking at just having the presentation in English. At some point in the future, we may be looking at multiple languages for this. In addition to the in-person, we will be videotaping Dr. Pomerantz's presentations and there will be two videotapes, one done for on the 10th, which will be the 6 hour class, and then one that will be done on the 12th. Now, the one on the 12th, which is for clients, consumers, persons served, and their families, um, is 4 hours. And there'll be one from 9 to 1. And right now we're negotiating with Kern Regional Center. We're going to try to find out if we can get the Malibu room from 5 to 9 rather than from 1 to 5, because we think that maybe offering an evening option for individuals would be a good way to have the second presentation. So really encourage you. There are a lot of training opportunities that are out there right now. California really wants to make sure that we are in full compliance with what the federal government is requesting of us in terms of, or requiring, I should say, of us for the waiver. And in order to do that, California's put some money where its mouth is and said, let's get some good training opportunities out there to folks so that they can learn more about not only the home and community waiver, but person-centered planning, independence, autonomy. All of that is the new look in services for developmental disabilities. And they really want to strive and get people to both not only be thinking about that, writing up plans for that, but also implementing that. And these are all good continuing education things. And then Dr. Pomerantz as well offers a whole series of resources. So if you take his class at the end there will be links to a great deal of sources. And he also says that for 1 year, if you take one of his classes, you can contact him by email and he will respond and will answer your questions. So you have an excellent resource backing you up if you take this training. Okay. This is a pretty complicated diagram here on the screen. It just came out from the Association of Regional Center Agencies, and it was recently placed on the Kern Regional Center website. And this is what they say is service coordination. Now, I sort of disagree. I think this is more case management and social work, which is different than service coordination. Service coordination to me is a much more limited function, but I think it's a good tool to use to look at what we as a system are really trying to accomplish with the people that we serve. So, for example, if you look at the very middle of this, let's see if I can get the pointer over there. Nope. Oh, there it is. If you look at the middle, it talks about person-centered planning, and what is that all about? It's advocacy, training, education, diverse communities. We want to get people involved with all of the folks around here. Crisis support, so the client has a situation where they go into either a mental health / behavioral crisis or a physical health related crisis. How do we get support to that person? And what are some of the services? Transportation, dental, nutrition, health, purchasing, healthcare, medicine. Some of our clients who end up involved in the court system, and that can include advocacy for those individuals to try to assist them with that process. Social skills, safety, hygiene, housing. So there's a whole number of things that are involved with when it comes to planning for that person and service delivery. So when if you have an individual in your program during the day, in your supported employment services, in your residential facility, and you're looking at doing the plan for that individual and implementing the plan, if we're thinking about what we're trying to accomplish when we're doing that. So it's not just the event. It's not like, oh, well, Susie needs assistance with brushing her teeth. And that very well may be the case. She may very well need that assistance. But by assisting her, are we helping her to learn how to properly brush herself so that she can take care of her own teeth? And in that, are we then including flossing, maybe rinsing, and all of those issues? Because we're not only talking about oral hygiene, so we want Susie to have good teeth, not a lot of cavities, not a lot of extractions, root canals, all the other things that go with dental issues. But also, we're trying to prevent gum disease, which can lead to very bad breath. It can also there is a bacteria that can then go through your bloodstream and go to your heart and create cardiovascular issues related to dental health. So when we're working with somebody on dental health, it's more than just teaching them how to brush their teeth. It's also about why this is important and what are some of the other benefits. And if that person's then going out into the community and their breath is fresh, their teeth look clean and not all yellow and what have you, then it really goes towards acceptance and their physical health, etc. So when we're working on things, we're working on more than just the actual one-time event that we're doing. We're also looking at how this relates to the big picture of helping this individual to be more independent for themselves. Years ago, it wasn't this way. We were looking at teaching people the skill, but it was more that often than not, instead of teaching, it was about we're doing this for you because this is board and care and you need care and this is how we're providing that care for you. So it's we're going to do this for you. Now those of you who have young children or have raised children or grandchildren know that you can do it for the child, or you can work with them on teaching them how to do that skill more independently, which then makes them more capable of navigating and negotiating the environment around them. So that's the direction we really would like to see. First thing we're going to talk about is healthcare. Now, have any of you would like to share a story, maybe a horror story that you've had with healthcare with one of the individuals that you serve, where they didn't get the healthcare that they should have because, in some ways, their intellectual or developmental disability sort of created a situation where the physician wasn't able to provide the right care. They weren't good reporters. They couldn't quite figure out what it was. They were dismissed because of the fact that they had a developmental disability, so that they didn't get what they needed. Anybody have an example? Okay, then I'll I'd like this to be as interactive as possible, but I'm not going to twist anybody's arm. So but please, if you feel like you want to speak
Jeff,
up, yeah.
hi, this is Jamie from Kern Regional Center. I don't have a specific example, but I do have to say that every time um, I either have an experience with a healthcare provider, be it, I had some dental work done this last year, or and I have to admit I struggle with like dental x-rays. So I always often think about, you know, being in the shoes of our individuals and, kind of the struggles that they have if they are not able to communicate. I'm able to tell them, hey, hold on, I can't, let's renegotiate this little cardboard thing you're shoving down my throat here. And, those sorts of things. I often think about, the struggles that they must have when they're, doing those same things, or, being able to describe pain that they're feeling, and being able to get the right kind of going in the right direction for the right thing, because you think about us and that we're able to, kind of put out there what it is that's really bothering us, and that they may have those, you know, struggles with trying to, you think of things as, even some things like foot pain or, things like that they may not even be able to communicate, but yet can be so painful for an individual. So, I definitely, unless they've got, that good support group around them that can really, explain what's been going on with them, I can see where they may not get the direction that they need as far as their proper health care. So I just wanted to throw that in.
Oh, no, thank you. That's exactly what I was. Okay. Could you turn your microphone off again? You keep causing an echo.
Oh, sorry.
That's all right. Um, Recently, I heard about a gentleman in his 60s who was developmentally disabled, went for yearly checkup, and the provider who was with the individual was asking the doctor about wellness part of the exam, and asked about, how about both a prostate exam looking for potential for prostate cancer, and also a colonoscopy to look for the possibility of anal rectal cancers. Uh, the doctor's response was, well, I have a pretty good relationship with this client. He doesn't get too agitated during the visits. And if all of a sudden he views me as someone who's sort of poking and prodding in a sensitive area, and also the fact that he probably won't be able to adequately prep for the colonoscopy because it's not the most comfortable and pleasant experience getting ready for that, cleaning everything out. So I'd rather not do it. So was it that he didn't want to do it because he didn't think that it was necessary for the client's health as to be part of that person's uh, yearly exam, or was it because he just felt like it would be uncomfortable for the person and might sort of affect the person when he came back the next time, because the individual might feel like, well, no, this person hurts me. So, that's an interesting question. I mean, we want to make sure people are getting the health care that they need and not being shortchanged because of the disability. And so if I'm getting the prostate exam and the colonoscopy at my age, should that person be getting that as well? So those are interesting questions. Are the individuals we serve in many cases are not good reporters. So when they go in to a doctor's office, they may not be able to really express what's going on. What is the if they're having pains, or they're having like dizziness, or they're having other issues, can they really adequately express that? I went to a conference one time where the speaker was talking about a gentleman who was had a more severe, almost into profound level of intellectual and cognitive disability, and he in the past had this behavior where he was sort of hit himself and what have you, and that they'd gotten rid of that. And then all of a sudden he started coming back with where he put his fist in his mouth and he's going and he kind of constantly be doing that. And so they got the behaviorists back out there. They started working on a plan. They started doing everything else. Well, lo and behold, the following year, when he went in for his annual dental exam, it turns out that he had a dental a mouth cancer, and the pushing was like pressure that he was putting on his mouth to try to, counterbalance the pain that he was experiencing. But he wasn't able to really, verbally express that to the people who were working with him or some of the medical professionals that he would come into contact with. Another thing that we oftentimes see is that our clients can be very sedentary. I just read an article yesterday that said they took a group of individuals who had Down syndrome and had them walk 30 minutes like 3 times a week, and then another group that didn't. After 8 weeks, they did like a cognitive test that they had done 8 weeks earlier, and almost all of the individuals who had been doing the exercise did better on the test. So we know for our own selves as well, and this is April Get Out and Move Month from the American Lung Association, that exercise, aerobic exercise, strength training throughout the week, 20, 30 minutes, at least 3, 4 times a week. Try to get at least once or twice strength training. If you go out there, there's all kinds of different guides on what's, you should be doing. And if you're going to be looking at putting in an exercise program for the individuals that you serve, you should contact their physician first and make sure that it's okay with the physician. And if the physician puts any restrictions on what they can do, maybe if for cardiovascular issues, he or she may want that individual to walk and not run, or maybe there's some other concerns of arthritis or other things that need to be taken into consideration if you're going to be looking at developing any type of exercise physical plan for people. Last year, our friends in Sacramento restored social and recreational funding to the budgets of regional centers. And so now that's also an opportunity for individuals served. There are, I know, at least 3 or 4 providers in the greater Bakersfield area. There's some in the outlying areas that are now have been vendored and are providing social recreational services. So that's something that can also be used to that. If you're a residential provider, however, that's they're interpreting that to be that you're a generic resource, that you're as part of your payment for the services that you provide, you're supposed to provide recreational and social activities, and so you're not eligible for those clients living in home supported living and other types of services. There are social recreational services available. Talk with the service coordinator that's involved with your program and with that individual, and you can get more information about eligibility and what services are available. Personal hygiene, important because of a number of reasons. If I'm out in the community and standing next to somebody who doesn't smell well, I won't be standing there very long. I'll be moving away, so that the impression that we give and how people perceive us. One of the things that we use is our sense of smell, and also if you look at somebody and they look unkept, their hair's not combed, like I said, teeth are problematic. You haven't necessarily had their other hygiene type services, that can be an issue. Also, one of the things that we do when we bathe, for example, is a couple of years ago, people were saying, well, don't use antibiotic soap. And the reason for that is because then you're creating, bacteria that's resistant over time. Well, when you bathe, what you're doing, the soap, is taking the oils off of your skin. And so that anything that's sitting on top of the oil, like bacteria, like dirt, like viruses or anything else, all get washed down into the drain when we bathe. So bathing regularly is a good way for in terms of our hygiene, and also washing our hands regularly. We got a good dose of that over and over again during the height of the COVID epidemic. How important it was to continue to wash your hands throughout the day and do it thoroughly, because it is a good way to prevent illness as well as promote wellness. Um, Physical changes. Uh, are we seeing changes in the person's capacities physically over time? Now, it can happen a couple different ways. If we see something very rapidly change, that's a pretty good indicator that something's very wrong. But if it's slower, we may, like, for example, at the yearly annual review IPP meeting, notice that, wait a minute, this person's functionality, according to our planning process, was better last year than this year. What's going on? Who do we need to work with to see if there's some sort of issue with this person? Don't just assume that it's part of the aging process. Interesting enough, people with Down syndrome have very high rates in their 40s, 50s, and 60s of developing Alzheimer's. And then I read one report that said that if they live long enough, almost everybody with Down syndrome will develop some sort of a dementia. So what are the changes? Okay, lifestyle issues again. That has to do with what's the person's diet, how active they are. Do they have friends? There's a lot of research that shows that if you're isolated and don't really interact, it really promotes depression, anxiety, and there's some studies that talk about longevity, and that the fact that if you're not connected to other folks, you may not live as long as those folks that are more involved. There have been a number of studies that looked at people who are involved in faith-based services. So they have religion and they are involved in a community of practice of that religion, and how that's beneficial towards people's physical health or mental health, etc. And again, as I mentioned earlier, dental services are a real integrated part of what we do. A number of years ago, during one of the state's budget crises, we're going into another one now. It's sort of like a cycle. I sometimes use the analogy of, if you go to Magic Mountain and get on a roller coaster, you go up for a while and then you come down and then you go up and you come down. That's kind of the way state budgets work, especially here in California. And we're now going into a down cycle. But in 2008, 2009, when the state had a very severe recession, one of the things that they did was they looked at cutting out Denti-Cal, which is the dental services under Medi-Cal. And I sort of scratched my head at the time and said, since when is the mouth not part of the human body? I mean, when we look at who people are, I mean, the mouth is very important. As I mentioned earlier, there are diseases like endocarditis, I believe that's how you pronounce it, that can cause bacterial infections of the heart, which are generated from hygiene issues in the mouth. So important. Now, medications. Most of the individuals we serve are taking medications. A lot of different issues related to medications. One is it being taken as prescribed? And two, many medications have side effects. And when you go to pick up a prescription, they give you that label that goes along with it, that if you can't sleep at night, read that because it's like long and it's difficult to understand sometimes. But it really points out what can be a challenge with taking that medication. So, for example, if somebody takes a medication for to that has a calming effect, it may lower blood pressure, and so that when that person then goes to stand up, they can maybe fall over. It could, some other medications may raise blood pressure and then create problems for that person related to potential for heart attack and stroke and other challenges that can occur from high blood pressure. So we want to be aware of potential side effects that the medication, and again, if the individual is a poor reporter of what's going on, it makes it even more challenging to both know what they're taking and knowing potential side effects that can occur from those medications. Okay, now health is an important area, and one of the areas that has really become more of a to the forefront in recent years, especially as we're looking really talking about greater independence and autonomy for individuals, is the whole issue of sexuality. And just like you and I, in most cases, want to be involved in interpersonal relationships that include a sexual component, in many cases, our clients would like to do that too. Relationships, skill, and relationships aren't necessarily easy for those of you who are involved in relationships or have been involved in the past and are now involved in another one, or whatever your relationship history is. You know that there can be many challenges involved with that. And so we want to really look at trying to teach social competency and assisting individuals with developing the skills necessary to be in healthy relationships with others. And that it also includes, again, that whole thing of informed consent, of talking with individuals about, no means no. If you're involved with someone else, what can be involved with sexually transmitted diseases. Kern County's got some just awful statistics when it comes to chlamydia and gonorrhea and some other things. And so that can be an issue for our folks as well. And then male and female health issues, as I mentioned earlier. We want to make sure that our clients are getting the screenings that are age appropriate based on their gender. So, female gynecological exams, male prostate exams, breast exams for women, other things that are important as we age to make sure that we can stay healthy. Um, and we also want to talk about abuse prevention. So we don't want to see our folks get exploited. Oh, well, Susie can do, she has freedom, she has autonomy, she can have visitors, this and that, all the things that we talk about when we talk about HCBS. But we also have to talk about, there's responsibility involved. There is common sense. We still have a role to assist the person when they're to provide them with the education and understanding that they need, and also to be supportive. So if we do find that someone has been involved with exploitation, what are we doing to do that? A number of years ago, I was involved with a situation where a client was all of a sudden the staff noticed some changes she was having, and they took her in, and it turns out she was like 6 or 8 weeks pregnant. Probably wasn't able to give consent. And so, there were some challenges that were involved in doing the case management, the healthcare services, the supported services, everything else that really was necessary for this individual at that point. and also, investigation as to, what indeed happened, and was this, a consensual situation, or was she taken advantage of by someone who was in a position of authority over her? And so we want to be really respectful of that, and to work with the individuals who are knowledgeable and can assist us. So if we don't really know what to do ourselves, get a hold of the resources that are out there. The Open Door Network in Bakersfield, the Alliance Against Family Violence is through that service. There are other services. There's adult protective services. There's the law enforcement. There are other folks that can potentially assist. Sometimes, again, using physicians or nurse practitioners or other folks to assist. Some individuals may need some follow-up counseling if there's some issue related to exploitation. But we also we want to make sure the person is taken care of. If those of you who do read my newsletter, the one that went out yesterday afternoon has an article from the LA Times from yesterday, as a matter of fact, about an individual who was in residential care, who the staff person, was very upset with the high level of demands they were making at some point. It's alleged to occur. The person denies it, and another staff person filmed it. So, and what are some of the consequences that are occurring with that? So it's an interesting story. If you get a chance, I would tell you to go back and look under the update section of the April newsletter. And there's a good thing there. One area that's sort of challenging for our individuals is the whole area of mental health. Have any of you had situations where you've been involved with Kern County behavioral health? Is what they call it now. They don't call it mental health anymore. That where they provided services to the individuals that you serve. Okay. The Lanterman Act, the law that creates regional centers, talks about that if a service is available to the general public, that service has to be available to individuals with intellectual and developmental disabilities as well. So if I, as an individual, am low income and am having some significant mental health challenges, I can go to the county mental health department or one of their contract agencies and ask for services and get an assessment to see if I meet the criteria for their services. Just like there are certain diagnostic criteria you have to meet to be intellectually and developmentally disabled under California law, there are certain rules that you have to meet to be eligible for behavioral health services. Now, if I meet those criteria, then I can get an array of services from the mental health system. Now, the mental health system is a different type of system than is the regional center system, and it's not necessarily an entitlement, and there is a more fixed level of services that they provide. It's not as open-ended as you can potentially get through regional centers. But there is a system out there, and we want to try to get individuals involved with that when necessary for both counseling and also for psychiatric, for medication care. One of the challenges, well, there's two that I can think of right offhand with using behavioral health services. One is that there is a sort of myth out there that's been out there for many, many years, and many clinicians, unfortunately, still see this to be the case, and that is if you have a developmental disability, if you're intellectual disability, you cannot also have a mental health diagnosis. That for some reason they believe that, and I don't know if the feeling is that maybe you don't have the cognitive understanding level to really know what a mental health issue is, or to be depressed or anxious or what have you. But that's sometimes you will hear mental health people say, oh, no, that person has a developmental disability. They should get all their services from the regional center. We're here for the people who have mental health issues. Well, guess what? when they statistically look at the developmental disability population, and there is a diagnostic manual that sort of modifies the criteria for eligibility to or diagnosis to correspond with the developmental disability, the numbers are fairly similar. The same percentage of people with developmental disability in the population as the general population have mental health challenges like depression, anxiety, bipolar disorders, etc. So it does exist. The other thing that oftentimes occurs is that in your program, you have somebody who has some maybe some aggressive tendencies, sort of can melt down sometimes. If you go to shift from one activity to another activity throughout the day, they have a very hard time transitioning, and they maybe will strike out or get verbally aggressive or what have you. Mental health sometimes will look at these behaviors and say, oh, that's a behavioral challenge. That's a learned behavior. The person's learned over time. They can get, if they do this, they can avoid doing something else, or that they don't want to do it. And that's their way of showing that they don't want to do it. And so that's a behavioral issue, not a clinical diagnostic issue. And that's something that we need to really look at too, is does this person really have a definable mental health diagnosis? Because again, they have their criteria of who gets in the front door and gets services and who is not necessarily eligible, just like the regional center does. I think sometimes we think, well, because the person's got some, in quotes, behavioral challenges. I hate that term because we all have behavior. If we didn't have behavior, we wouldn't be alive, because right now my behavior is talking to you. So but there are specifics, and there is a manual that's used that gives the criteria for what constitutes the different diagnoses. And again, if some modifications are used to that to account for the intellectual or developmental disability, many of the people we serve could qualify for mental health services. But it's, as I asked earlier, that if you have an experience and nobody, so I'm assuming that not many of you, if at all, have used that particular resource. Okay. All right. That's what's, I'm creating more slides that I didn't mean to do. Okay. This will be the last slide we'll do today, and then I'll take questions if anybody has anything. When we're working with our clients, and again, this is like what I was mentioning earlier about individual skill that we're working at and big picture. What are we trying to accomplish? Organizational skills. Are we really trying to teach that person how to get together? Front part of our brain, the prefrontal lobe, is where our is what we call executive function. And I heard somebody say one day that if you think about an orchestra, and the conductor is up front and he's conducting, and then the orchestra then plays the music corresponding to the instructions that they're getting from the conductor. If that conductor was gone, within a minute or two, the wind section would be doing one thing, the percussion would be over here doing something else, the strings might be doing something else, because there isn't that organization. So when we get up in the morning, think about it. What you get up? Okay, this is Wednesday. Wednesday, I've got to do this. I'm going to take this class from 10 to 11. Oh, by the way, I got to take something out of the freezer so that we can have dinner tonight. You're doing a whole bunch of different tasks to organize your day, your time, your thinking process, how you're doing your day. Some of our clients have never really had the opportunity to develop those, thinking about their full day and what they need to do. Social understanding and relationships, teaching people appropriate social behavior. If I meet you and I get like 2 inches off of your face to when I'm talking to you, I'd be like violating your personal space. And that might really be something that you would then want to get away from me, because that's not something that you would want to see occur. So there are a number of things that we wanted to talk about. Communication difficulties. Some individuals have difficulty communicating. Individuals who might have cerebral palsy, or other challenges, and that can have a real effect on their ability to make their needs known to others. Hey, what's going on? And also to share in things. Okay, I'm going to go ahead and stop it here. We'll save the other slides for another presentation. And I'm willing to take questions for the next couple minutes. Anybody have any thing that they would like to share or ask? Concerns?
Hi, Jeff. This
Yeah.
is Jamie from
Uh-huh.
Kern Regional Center. This last slide really resonates because I think you're right. Um, them having opportunities to gain some of those organizational skills and different things that you just talked about is really important. I think something that kind of goes unnoticed just in the regular day of, trying to maybe the staff getting through the day or, their care provider or whatnot, they're not so much focused on giving them those opportunities to organize things that they might be able to, be involved in. So I appreciate that point.
Okay. Well, thank you. Yeah, in many ways, it's easier to sort of do things for folks, or to just push people along or prod them, and if that works, gets it done. But in the long term, if what you're really attempting to do is to teach that person to do it, and it will actually lessen your work the more that they're able to do for themselves. So it's like, up front, there's a little bit more work, but in the long term, it probably, uh, it benefits both the client and you as the provider as well. Okay, any other questions or concerns that people have? Well, thank you. This webinar will be repeated with a slightly different approach next Wednesday for residential providers, and then the following week on the 24th, there will be a 1.5 hour webinar talking about skill development as well. So we look forward to that. Also look at the CQL continuing education credits and the Dr. Tom Pomerantz. And I encourage you. I know you're very busy. You have a lot of things that you need to do for your work and for your lives. But this is all of this. And if you can't do it all, pick out one or two that's relevant to what you need, and I encourage you to get involved. And with that, I'll say goodbye and have a great day.
Thank you, Jeff.